So in case of radius, never go for IM pinning because of these two reasons. The medullary cavity is irregular. Medullary cavity is irregular, so you cannot enter with your straight IM pin. And second reason is both the end of the radius they are covered with articular cartilage. So there is no site for entry point because if you enter from either end, you may damage the articular cartilage. That may end up in osteoarthritis and delayed union. In case of femur, this is the head covered with articular cartilage. But at this site, trochanteric fossa, no articular cartilage, we can easily enter through the trochanteric fossa and we can put our IM pin. But that facility is not available in radius because both ends covered by the articular cartilage. And second reason is this medullary cavity which is irregular. So we are studying about the medullary cavity and its variations with the orthopedic link. So radius is over, which is having exception covered with the articular cartilage and having irregular medullary cavity. Then what about ulna? Radius, never go for IM pinning. Second one is ulna. The problem with ulna is this ulna bone is like this. In case of ulna, proximal 2/3 is wide, so you can place your IM pin here, but this distal third is narrow. So intramedullary pin can be placed up to this point, up to proximal third, not below this. So if there is a fracture of this shaft of the ulna, you can apply your pin, but at this level. So in case of ulna, intramedullary pinning is done in proximal 2/3 because the marrow cavity is so narrow that the pin will not enter. So this was the first orthopedic link of medullary cavity. Second, number 2. What is the role of medullary cavity? This is the femur, head of the femur, greater trochanter, lesser trochanter. Number 2 is the selection of intramedullary pin size. In books it is given 70% of the diameter of bone, medullary cavity. This is the medullary cavity. So the size of the pin should be 70% of this diameter. But the question is, from where? From where to take this 70%? At proximal, at middle, at distance. From which point we have to take this 70%? The answer is, there is one region called isthmus. Meaning of isthmus means narrowest diameter of medullary cavity. For example, if the diameter here is 6 millimeter and diameter at the mid shaft it is 6 millimeter. If the diameter here is the 5 millimeter and here is 7 millimeter, 8 millimeter, 9 millimeter, here 10 millimeter. So which one is the narrowest diameter? That is the 5 millimeter. So we will take 70% of 5 millimeter. This 5 mm is called isthmus, is called narrowest point of the medullary cavity. This will be our target from where we can calculate size of our pin. So if this 5 mm is my isthmus, narrowest diameter, so suppose 3.5 mm is the pin size. So you can take 3.5 mm pin and you can enter or start your intramedullary pinning. So this narrow cavity is very important in orthopedic. Without knowing the diameter of narrow cavity, you cannot go for intramedullary pinning. Once you know the narrow cavity diameter, then calculate the narrowest one and then take 70% of that and select your pin and go for IM pinning. That landmark will be trochanteric fossa. The next question is, why 70% of this 5 mm? Why 70% of this isthmus? Why not 80%? Why 90%? Why not 100%? This is the femur of a dog. The question is, why 70% of medullary cavity? Why not 100%? If this is the medullary cavity and size of medullary cavity, suppose it is 3.5 mm, that is the 100%, and 70%, the recommended rule is take 70%. Suppose it is 1.5 mm, 70%. We cannot take 100%. Why we are taking 70%? The first reason is to avoid magnification error. To avoid magnification error. If we take the X-ray of an animal, there will be some kind of magnification error. That may be starting from the 20% up to 30%. So what we do, we try to avoid this 20 to 30% magnification error. That's why we go for the 70% selection of this narrow cavity. The second reason, why to go for 100%? Oh, why not to go for 100%? Second reason, dog femur is curved distally. The femur of the dog is not straight. This femur is curved like this. If you take this 3.5 mm pin and you start your IM pinning, then 3.5 means 100% you are covering the marrow cavity. Then you can end up with this point. After this point, this marrow cavity is curved. Your pin will stuck here only. If you take 1.5 mm, that pin is thin and it is flexible. So if you take 1.5 mm, the pin will come, and where it is curved, the pin will also follow the route and it will go easily and it will sit at the condyle, here only. So because of these two reasons, we go for 70% of the medullary cavity. First is to avoid magnification error. Second is this femur of the dog is curved at the distal end. If you take 100% diameter 3.5, your pin will come and will stuck at the curve point. After it is curved, pin will be here. Then migration complication will be there. If you take 1.5, it will easily come because flexible. It will also curved with this curvature and sit up to the condyle. So that's why these two reasons 70% is taken. What happens in case of cat? In case of cat, in case of human, this femur is straight femur. But in case of dog, femur is curved. So this is the orthopedic link with the medullary cavity of a long bone. So what we learnt in this lecture, first is types of bone, that is long bone, short bone, irregular, visceral. There was one more flat. And in case of bird, pneumatic bones. Number 2 was the parts of long bone. Parts. I explained epiphysis, their type, then physis, their Salter-Harris fracture, and at the end, what we saw, this medullary cavity and its role with respect to radius. Never go for IM pinning. With respect to ulna, only upper 2/3 you can go for IM pinning, and selection of pin size, pin diameter, that is 70% of medullary cavity. And at what place? At the place of isthmus, narrowest point. Why not 100%? Two reasons. So this is the orthopedic link and these are the bones. In next lecture, we'll see these ends, they have cancellous bone. They have soft cancellous bone. And what is present here? That is cortical bone. This diaphysis is having cortical bone. So with these two bones, we'll cover the concept of screw. We have cancellous screw and we have cortical screw. And what is the concept of leg screw? What is the concept of plate screw? Leg screw and plate screw. And what is the difference between cancellous and cortical screw? And what is the difference between cancellous and cortical bone?